Good afternoon and welcome. We are so excited to see so many of you here to join us for the Helen L. Erickson Lectureship in Holistic Nursing. For those of you who know our fearless leader, our dean, our leader, you know that I'm not her. You may be surprised to hear that today Dean Steifbergen is speechless. She has asked me to be her voice today and is here to listen. Let me introduce our dean, Dr. Alexis Steifbergen. I am Linda Carpenter, assistant dean here, and hopefully a worthy dean substitute just for a few moments. And again, I want to thank everyone for coming. I hope we have a few students trickling in here in the next few minutes. The Helen Erickson Lectureship is such an important event here at the School of Nursing. It was established in 1997 by family, friends, colleagues to honor Dr. Erickson's many contributions to the UT School of Nursing. It also is to provide support for educational symposiums in the area of holistic nursing specifically. Dr. Erickson is a visionary who changed nursing practice in a profound way, a defining voice in holistic nursing. She had a spiritual view of nursing practice that encompassed caring for the whole person, not just the physical needs. She was recognized as a holistic nurse in 2012 and Holistic Nurse of the Year, by the American Holistic Nurses Association. She studied and taught at the University of Michigan, but finally, as some of us do, finally made it to Texas and retired from UT Austin, where she was awarded Professor Emeritus in 1997. We honor her work here today. Dr. Erickson sent word to the dean last night. She had hoped to be with us here today, but an illness of a family member will keep her away. She said she's sorry to miss this and wishes us well. So before we begin with our speaker, I'd like to recognize some other guests today, some important people that we have here in the room. And I'd like to introduce you to our former dean, Dr. Billy Brown. We're happy she's here with us today as well. We also have several former faculty members, and maybe it would be best if you are a former faculty member, could you please stand and be recognized? It's great to see them here too. And I was told we have some advisory council members here as well. Can you stand for us and let us know who you are? Here we are. Very good, very good. Thank you. And yes, indeed, this is a very special lectureship, and I think you will soon see how fitting it is that we have Dr. Barbra Mann here with us, one of our own graduates from the BSN program here during this Longhorn Nursing Week at the Helen Erickson Lectureship in Holistic Nursing. And I understand that she is joined today by some members of her family, so I might ask them to stand too, because they are very important guests as well. Very good. Thank you for coming. Dr. Mann-Wall's topic is historical roots of holistic nursing. And so we have with us a true historian, a nurse, a UT Austin BSN nurse, who has scholarship and had contributed an important perspective on Catholic nursing, Catholic hospitals, sister nurses, and nursing care in disasters. Her master's is from Texas Women's University, and her PhD from the University of Notre Dame. I wanted to mention a few things. You have her bio on the back of our program today, so you can fill in some of the details, but she has been a part of 2 award-winning books that I think are just amazing. Unlikely Entrepreneurs, Catholic Sisters and the Hospital Marketplace from 1865 to 1925. I have to read it now. I have to go and get it because it looks so interesting. Another work has to do the nurses on the front lines when disasters strike, 1878 to 2010. Would not that be interesting? And then most recent work, American Catholic Hospitals, A Century of Changing Markets and Missions. So it sets the stage for what she will be sharing with us today in relationship to holistic nursing. And if all of that wasn't enough, I found it very interesting and just wonderful that she has been recognized for her distinguished teaching. So she has been awarded the Family and Community Health Department Award for exemplary teaching. She has been awarded a Trustees Council of Penn's Women's 25th Anniversary Award for Excellence in Advising, and also the Lindbeck Award for Distinguished Teaching at the University of Pennsylvania. So again, I think that this is a wonderful opportunity for us to hear her work and to recognize the things that she has done since she left UT Austin with her bachelor's degree. So I want to give you now our speaker, Dr. Barbra Mann Wall.
Okay, thank you, Dr. Carpenter. Can you hear me? For the past week, I've been like Dr. Steinbergen, voiceless, and I think that it's better today, so I hope I don't have a coughing fit right in the middle of this, and it might happen. But thank you to Andrea Brannon and her team, Michelle Voss and Marissa Alvear. They've been wonderful in setting all of this up. I want to welcome my family. And my sister looks just like me, so she's a twin. We're twins. As Dr. Carpenter said, I'm coming home. I graduated from the University of Texas with my BSN in 1971. And this is where my career started. Now, for those of you, I know Dr. Brown will recognize this picture, and Dr. Rickelman and Mrs. Dreer will recognize this picture. I graduated when the building was still the old CP Hall. It was one of the few remaining World War II Army barracks that had been converted for classroom use. So it makes me feel very old when history becomes something that I remember. So Dr. Brown was the head of the School of Nursing then, and I want to acknowledge her presence today. She was really instrumental in putting UT's program on the map, and I'm proud to say that she was and remains one of my most influential mentors. So thanks, Billy. I also just found out that Mitzi Dreer and Bonnie Rickelman are here. These were my instructors back in the 1960s and 1970s, and it's wonderful to see them. As the introduction noted, I'm a nurse and a historian. I'm a hybrid. And my talk today will focus on both nursing and history. So first I'd like to start off by saying something about the importance of history. Modern nursing is a practice profession and a scientific discipline, and history is critical to its identity, its scholarship, and its relevance. History provides meaning, and this meaning is infused into any area that we might want to study. It helps us understand what worked, what didn't, and why. In all of our studies, we need to understand the interactions of time and place and the changing social, political, and cultural context. So today I want to provide an historical perspective of holistic nursing and the ambivalence among nurses that this has sometimes caused. I'll use examples from Dr. Erickson's scholarship, the work of nurse historians, and my own work. Dr. Erickson has written about the use of touch, massage, eye contact, soft voices, and other comforting measures in helping people, quote, get well, stay well, and have a peaceful death. She convincingly asserts that, unfortunately, nurses often fail to recognize the importance of their care. As a result, as technology advanced, many discarded the age-old wisdom embedded in the art of nursing and turned to the values of other disciplines to articulate the essence of nursing. As a result, Dr. Erickson became very influential in helping nurses to rethink this whole idea of what it is that we do. In the 19th century, the term holism was not yet used to describe nursing. Still, holistic notions conceptualized nursing from the very beginning, and its meaning has changed over time. Nurse historian Patricia D'Antonio has written extensively about nursing's origins in the domestic realm. Nursing was part of women's domestic duty, usually practiced in homes and limited to caring for immediate family members, other relatives, and neighbors. Some women were called natural-born or professed nurses, and they used their skills to provide an income. Women's duties in the home consisted of feeding, bathing, cleaning, and coaching people under their care. And to D'Antonio, these womanly duties have been the sources of nurses' strength. Nurses are the ones who have been able to make a home of the hospital, to personalize an increasingly impersonal environment. But she also notes that nurses have been reluctant to claim such a past because the present values rationality, objectivity, and autonomy from medicine above intuition, subjectivity, and interdependence with medicine. And anything that speaks of domesticity might undercut attempts to develop and publicize the autonomous and professional aspects of practice. But we cannot ignore the historical roots of what were nurses' strength and power. Nurse historian Joan Leinau carries this argument further. She reminds us that nursing, as we know it today, was invented in the United States in the 19th century around the 1860s and 1870s. It grew out of a public demand for knowledgeable caretakers because society did not want to abandon their loved ones to uninformed and unreliable care. It was intended that nurses deal with the individual and the collective problems created by dependence in the circumstances of illness. And yes, nursing had its origins in women's unpaid domestic work, but Leinau also credits the work of religious sisterhoods in nursing. My own research has focused on nursing's roots in the religiously inspired human services of the Catholic sisters. Protestant deaconesses also were early nurses. All of them viewed nursing as caring for the whole person, body, mind, and spirit. So how do we know this? Well, we have these old texts, and we can find evidence of holistic nursing in these sources. Now, you all recognize the one on the right, Florence Nightingale's Notes on Nursing, and I will get to that one in just a minute. But first, I want to talk about the one on your left. One of the earliest Catholic texts for sister nurses is a handwritten one, located in the archives of the Midwestern province of the Daughters of Charity of St. Vincent de Paul. It was written in 1841 by Mother Xavier Clark. She was superior of Elizabeth Seton's Daughters of Charity in the United States. And it was called Instructions for the Care of the Sick. Now, this is a French version. It was translated into English for the sisters. It was intended as a reference for sister nurses to keep in their pockets. And these instructions are full of references to care for both body and spirit. For example, Mother Xavier reminded her sisters to speak softly and to work gently, quietly, and unhurriedly. Nurses were to care for the physical problems first because, quote, the union between the soul and the body is so close that when the latter is suffering a great deal, the other, attentive to its wants, cannot think of anything else. Mother Xavier also taught her sisters to speak words of instruction and encouragement. She stated, long talk and many unguarded expressions and superfluous words generally produce more harm than good. The nurse also was to seek knowledge, ask questions, and be decisive. The experienced sisters must guide the others. Indeed, they must know everything. This included advising the less experienced nurses when they were not yet skilled enough to care for the sick, and the sisters would teach the men who were caring for the male patients. The sister nurse's important role with the dying is highlighted in an entire chapter of Mother Xavier's text. Sister nurses were to bring their patients into a state of grace, prepare them to make a good confession, offer silent prayers for the deathbed conversion of a Protestant, and carried out detailed instructions in verbal prayers for Catholics. These sisters traced no direct line to Florence Nightingale until the 1850s because the sisters' nursing was specific to their own historical time and their own vision of nursing. By comparison, Florence Nightingale wrote Notes on Nursing in 1859 after returning to England from Crimea, and her celebrated status helped legitimate her vision of nursing. This book was written to all women who nursed in the home. Many nurses tell a heroic version of the story of Florence Nightingale, although, as I've just described, women were nursing long before her. Nevertheless, we know that Nightingale profoundly influenced the training of secular nurses in the United States and in England. And I would say, actually, it's in many parts of the world, because it's amazing how often and how much this Nightingale model has been transported and translated to other countries. As the more I study globalization, the more I see that. Historian Charles Rosenberg argues that it would be hard to overestimate Nightingale's influence in the shaping of modern nursing and the reordering of hospitals. She began nursing in the 1850s, and she worked with both Protestant deaconesses and Catholic sister nurses in England, Germany, and France before she ever went to Crimea. So her experience as a nurse was relatively slight before the Crimean War. Nightingale's work with nuns during that war significantly influenced her conception of nursing as a religious duty and as a disciplined and organized practice under a female hierarchy. Nightingale also drew strongly on her experiences as an upper-class woman who was expected to care for family members and workers on their estates. The disasters that Nightingale perceived in military and civilian health care during the war confirmed her belief in the necessity of good character and discipline in nurses. She admired nuns' obedience, self-sacrifice, and hard work, but she could not accept the Catholic faith. And when she worked with nuns in Crimea, she criticized their zealous efforts to win converts. Hence, her plan for hospital reform called for sister nurses to work under the direction of secular women. And that caused great conflicts in Crimea between her and the nuns. One of the sisters, I never knew that one of the sisters' names was actually Mother Bridgman, because I'd always studied Florence Nightingale, who referred to her as Mother Brickbat. So there were great conflicts there. Nightingale conceived of illness that was representative of society at large. And let me add here that nursing's affinity for holistic health ideas is closely related to changes in medical thought and in social attitudes about health and disease. To Nightingale, disease was, quote, a reparative process, not necessarily accompanied by suffering. Disease was nature's way of remedying a process of poisoning or decay. The role of the nurse was to put the patient in the best condition for nature to act upon him. Nightingale's expressions conformed to her environmentalist ideas on disease causation. Now, one must be careful with 19th century understandings of disease, because this was a period of competition among many medical systems and theories. Terms such as contagion, the vehicle by which disease is transmitted from person to person, and miasm, the pathogenic discharge into the atmosphere, were part of this system of disease causation. Sometimes these terms were not fully distinguished, since both involved transmission through the air. At other times, miasm was used in a more restricted way, as something arising from stagnant water or decomposed vegetable matter. A broad framework of disease causation, however, included some common concepts: the centrality of hygiene, and understanding that the mind and body were mutually interactive and that the environment could affect both. Nightingale represents a peculiar variation of such views, one that highlights the role of women and particularly the role of the nurse. She argued that the atmosphere served both as a cause of disease and as a vehicle for its transmission. It was women with appropriate character and discipline, honed by careful training, who would impose the nursing order needed to restore health in both homes and hospitals. To Nightingale, hospital infection was the consequence of untoward behavior, poor planning of windows, slovenly nursing, cold and ill-prepared foods, drains and sinks placed where they might contaminate the atmosphere, inadequate ventilation, chamber vessels unemptied for hours, were all consequences of incompetence or irresponsibility. Nightingale's frame gave the nurse an indispensable role. Indeed, hospital wards were, quote, healthy or unhealthy, mainly according to the knowledge or the ignorance of the nurse. She could be pretty tough on us. Nightingale saw a unique role for nurses, which was different from medicine. In fact, there would be no need for doctors if nurses did all they were supposed to do. And if you think about it, if disease is caused by filth, you empty those vessels, you open the windows, you get this contaminated atmosphere out of the way. These were things nurses did. So that if nurses did all that, they wouldn't even need doctors. And these beliefs were all linked with holistic views on healing and disease. Nightingale's great legacy for nursing is that she made it a legitimate field for women to enter. They could work outside the home while still keeping soul and mind together. Today, historians debate whether or not Nightingale accepted the germ theory. Historian Charles Rosenberg asserts that if she did believe that germs cause disease and not filth, then that would negate everything she had dedicated her entire life for. But again, there's great debate on this. Lynn MacDonald, who has done extensive work on Nightingale, disagrees and says that she did accept the germ theory eventually. And Nightingale wrote so much that over the years, she wrote hundreds and hundreds of letters. Over the years, she begins sort of to contradict herself. But I think it also shows her growth also in her own thinking as a nurse. But all of these tensions demonstrate the ambivalent stance among nurses and others in the 19th century toward changes in medical care. Sorry. I'll try not to do that again. The American Civil War is another period where women played key roles in nursing the whole body. As many as 20,000 women worked in Army hospitals, hospital ships, and field hospitals for both the Union and the Confederacy. As you can see here, we have African slaves. Actually did most of the work in the South. They were the main people who nursed in the South. Catholic sisters also nursed. We had women from all various social classes, both Protestant and Catholic. All of these women blurred the line between the home and the battlefield. And indeed, it was the link between nursing and domesticity that got women in the door, so to speak, because of cultural assumptions about women as nurturers and caretakers, even though men also served as nurses during the war. More than 600 Catholic sisters worked in both the North and the South. Now, one of the religious orders that nursed in the war included the Daughters of Charity of Emmitsburg, Maryland, founded by Elizabeth Seton. And obviously, these are the ones, the Daughters of Charity, founded Seton Hospital here in Austin. When I was in school here, it was I believe I did my OB in 1970, and I still remember one of the sisters wearing her habit. And I used to hide, but instructors didn't know this, but I would run. I would try to hide in the elevator or room when I saw the Catholic sister coming. She was so intimidating to me. But and little did I know that I would be writing about them many years later. This was also Mother Xavier Clark's organization. She also was a Daughter of Charity. She's the one that wrote instructions on the care of the sick. So this is a photo of the sisters at Satterley General Hospital, the large Union facility in Philadelphia. And I'm doing some work on that right now. This is Satterley Hospital. And here's another link to Nightingale. After the Crimean War, she not only wrote notes on nursing, but she also wrote notes on hospitals. Her ideas for construction of hospitals included the pavilion design, and that's what's shown here. These are rows and rows of pavilions of hospital wards. And that included providing patients with clean, airy hospital wards, staffed by compassionate nurses who supplied good food and clean water. This made a huge difference in how likely a man or a woman would survive a wound or infection. Led by Sister Mary Gonzaga, the Daughters of Charity as nurses oversaw 50,000 cases from June 1862 to August 1865 at Satterley. This is showing them in the kitchen. They fed patients, kept them clean, did dressing changes, and gave medicines in a clean, well-ventilated, nourishing environment. They also cooked wholesome food. There is no doubt that the soldiers were rough men who exhibited rough behavior, and there were guards stationed around the hospital. Priests and pastors from local churches circulated the area also. But there were other ways to help the sick while also maintaining behavior. Nuns wrote letters for the patients, and they read to the men. Satterley Hospital even had a reading room with books and newspapers. Local women brought in comforts and entertainment. All of these activities promoted healing. Drew Gilpin Faust, who is now president of Harvard University, has written a book on death in the Civil War. It's called This Republic of Suffering, and it's won all sorts of awards. She argues that for all the horrors of combat, soldiers dreaded dying of diseases even more. The war that was expected to be short-lived lasted 4 long years, and it touched the lives of nearly every American. As men fought in the battles, they contemplated death. It was all around them. And a good death was very important to them. These terms, a good death, is so common in all of this literature. They wanted comfort and peace of mind and help with what lay ahead. Spirituality helped them in this arena. Assumptions about how to die were central to both Protestant and Catholic faiths, but they spread beyond formal religion to become part of a general system of belief held across the nation about life's meaning and life's appropriate end. Faust asserts that what resulted was an ecumenism that included cooperation among pastors and soldiers of different faiths. I would add among nurses of different faiths. The shared crisis of battle yielded a common effort to make the notion of a good death available to all. So at a time when people were still dying at home and being under the care of family members, this was different. The 4 years of the Civil War overturned any expectations the soldiers had, as they died in the company of strangers. It was nurses' roles to help them when they were dying, to comfort them, provide them a Bible if they wanted, give them relics and crucifixes if they were Catholics, and to write their families back home that they had indeed died well. In the hospitals, nurses might cooperate in the search for kin. They might help delirious soldiers. Just a minute. Okay, can you still hear me? Okay, sorry. They may help delirious soldiers to think about their mothers or their sisters. Clara Barton was a nurse in the Civil War, and she experienced a real crisis when she was with a soldier who was dying and mistook her for his sister. She could not bring herself to call him brother, but instead she kissed his forehead. So, as she explained, the act had done the falsehood that the lips refused to speak. Other witnesses reported soldiers' deathbed conversions, and family members of the soldiers eagerly looked for evidence of salvation. Both Protestants and Catholics competed in this realm. Nathaniel West was the Protestant chaplain at Satterley Hospital. He was asked if the Daughters of Charity tried to convert the soldiers to Catholicism. He answered, "If they do and succeed, this kind of conversion is not confined to the sisters alone. Who will blame a Protestant for making a Protestant out of a Catholic?" And I'm describing these incidents to show that spiritual care was central to nursing as they worked with the ill and injured in the Civil War. And again, as I'm doing some more work on this, I'm seeing it, I'm looking at work by Mary Livermore, who was a Unitarian, and spiritual care was very important as she worked with soldiers up and down the Mississippi River. So it was very, very important at that time. After the Civil War, the acceptance of women in nursing as a substitute for family caregiving became even more prevalent. Philanthropic women who had seen what good nursing could do during the war began establishing schools of nursing, each associated with a hospital. Right here are students at Mercy Douglas Hospital in Philadelphia. It was the School for African American Women. This is a school in Indianapolis. We're a school in Indianapolis, a School of Nursing, and this is how our diploma programs got started. Each was associated with a specific hospital. And for the men in the room, I don't know that I see any men nursing, but this was the time that women began overtaking men in nursing in terms of numbers. Now, by the beginning of the 20th century, nurses' roles were changing yet again. Hospitals were growing across the country due to industrialization, with jobs that took people away from the privacy of their homes. Urbanization expanded, and the transportation revolution made it possible for people to actually get to the hospitals. There were streetcars, there were trains for people to come from rural areas. They could actually get there. As well, the germ theory had been accepted, and this led to the adoption of antiseptic and eventually aseptic surgery, so that more and more people went to the hospital without dying. And for hospitals to stay open, they had to have nurses. This is a picture from the Barbra Bates Center for the Nursing History, Barbra Bates Center for the Study of Nursing History, and this is a picture of Philadelphia General Hospital operating room around 1925. We have lots of these pictures. I'm showing you some. I invite you to go to our website to see many more of them. Also, a new model of disease took shape, the interventionist model, with specific diseases requiring specific treatments. This model was reductionist and technological. By examining it from a historical perspective, we see that many of the problems that stymied American nursing back then have not been truly resolved. Old problems can reappear in new trappings. One of nursing's more vexing problems is hospital nursing, with large numbers of patients. We still have that problem today. Instead of caring for families at the bedside, in the early 20th century, nurses were now working in hospitals as substitutes for the physician. Nurses, like all members of society, were captivated by the successes of medicine over epidemics and other diseases, and they collaborated with physicians in carrying out their orders to care for the acutely ill in hospitals. This collaboration with the disease-focused model lasted more than 70 years. And this is a photo of Philadelphia General Hospital and the men's eye ward, and you can see doctors with a nurse, and they're working on his eye. This was also during the progressive era, when people believed that problems society faced, be they poverty, violence, greed, racism, class warfare, all of these could best be addressed by providing good education, a safe environment, and an efficient workplace. It was a period of social activism and political reform that emphasized efficiency and scientific methods for everything from housekeeping to medicine. Nursing had its own progressive leaders. Historian Geert Boschma has written that these leaders were still trying to hold on to their own ideas about holism and family-based care. And this can be seen in their work in the public health arena in the early 20th century. Adelaide Nutting, Lavinia Dock, Lillian Wald, Annie Goodrich, all of them helped move nursing into the area of public health. In 1893, Lillian Wald founded Henry Street Settlement after witnessing firsthand the poverty and hardship endured by immigrants on the Lower East Side of New York City. She and other nurses moved into the neighborhood and lived among the immigrants and workers, and their building is still there. It's still a visiting nurse society. If any of you ever go down to the Lower East Side, it's a great walking trip to walk down and look at the Henry Street Settlement. The women began visiting nurses. They became visiting nurses, and they provided health care to residents in their homes on a sliding fee scale. In addition to health care, nurses provided social services and instruction in everything from English to music classes. And for children, as you can see on the right, they had a playground in the backyard. Other public health nurses worked in urban areas that had large numbers of new immigrants, and education in the community became a key role for nurses. You can see this one nurse here. I think this is in the tenements, on top of the tenements in New York City. This is the Visiting Nurse Society in Philadelphia. This is a nurse here in the midst of some of the children going into one of the homes, and this one is from our collection. Annie Goodrich wrote that nurses should use every opportunity to educate people about health and lifestyle improvement. Visiting nurses increased in number, and they went into homes, schools, and neighborhoods and taught about diet, healthy habits, and personal hygiene. Now, some people have criticized these nurses for pushing middle-class values, and I expect they did. Not everyone had to eat with a fork, and that was one of the things they pushed, but other things that they taught were important. Certainly the hand washing and covering your mouth when you cough, those kinds of things. Those types of healthy habits were major factors in preventing infectious disease and infant mortality. Nurse historian Karen Buehler-Wilkerson has studied this period, and she knows that in this person-focused model, nursing was holistic and comprehensive. And while it included physical care, it also included social and mental health aspects. Lavinia Dock was committed to caring as a social responsibility for the welfare of society. She was a feminist and a social activist, and these experiences enriched her vision of nursing. And this is a picture of her vision. I took it from one of her books. She sees nursing as both a science and an art. At the core of the figure, representing affection, intellect, and abilities, we have the heart, the head, and the hand. She positions the hands of the nurse as caring for all of these areas. They worked with the individual, the family, and the community. Nursing's roles were preventive, educational, curative, and alleviating. And surrounding this core are all of these activities that nurses do. And she doesn't want us to forget that the spirit of nursing is service. And in fact, nurses are activists. And this is something that we can still use today. Now, I'm going to turn the slides off just for a few minutes, and I'll come back to these in just a few minutes. To educate nurses properly in these holistic roles, nursing leaders believed that nurses needed better education, and they began pushing for a professional and independent nursing education that was different from hospital training. This happened at Teachers College at Columbia University, where Adelaide Nutting and then Isabel Stewart were the deans. Teachers College was the first academic setting for nurses. It started for nursing education. It started in 1899. These leaders argued against the authoritarian hospital model, where nurses carried out doctors' orders without being independent professionals who served the community. But the idea of comprehensive care was more easily adapted to education system than to practice. Nurses argued among themselves as to whether or not public health nursing, with its holistic focus, should be a separate field altogether from nursing the sick. As a consequence, this holistic public health approach, which really had legitimized nursing's claim for more independence and better education, became increasingly marginal compared to the boom in hospital medicine. Hospitals continued to grow, and more paying patients came in 1929 and 1930 when health insurance came on the scene. And of course, it happened at Baylor Hospital in Dallas. Rather than seeing the patient in the context of family and community, the medical diagnosis was what was important. Care for the patient in the hospital became increasingly technical and complex, and nursing became more task-oriented. Furthermore, as the threat of infectious disease diminished and immigration restriction after 1924 decreased the number of immigrants coming to the country, the need for public health nursing decreased. Although the professional independence based on comprehensive care lost its community base, it kept its legitimizing and ideological function in academic nursing. As hospital nursing grew, nursing leaders and academics began focusing on defining the nurse's role toward the individual patient. Nursing care was reconceptualized to include the totality of the patient. In the 1950s and 1960s, the individualized nursing care plan came into being. It was comprehensive and patient-centered. And now we get into the 1960s, and again, it's a little bit depressing. I remember every bit of this. But while at Texas, I studied Ernestine Wiedenbach's book, Clinical Nursing, A Helping Art. And I'm looking at my professors here because they were so influential in this area for me. The title speaks for itself regarding the importance of both the art and the science of nursing. I still have that book. Nursing leaders also began focusing on the nurse-patient relationship. The nurse had an independent role and responsibility to use personal interactions to help the patient recover. Under Dr. Rickelman, I studied Hildegard Peplau, and I studied Ida Orlando, who wrote about the interpersonal relationship between the nurse and the client. The biopsychosocial approach was advocated. This was instrumental in resolving the patient's problems, and it became part of the professional definition of nursing. Virginia Henderson also focused on the relationship between the nurse and the client, and her view was also holistic. Nursing involves serving individuals as members of a society or family, identifying and improving nursing activities, including the related arts, procedures, or techniques, developing political and managerial competencies, I like that, political competencies too, and maintaining effective human relationships. It also involved helping people cope with disability, promoting a peaceful death when death is inevitable, and promoting self-care. And I still have her book also. These are classics. In these views, the nurse was not the physician's substitute. I went to graduate school in the late 1970s, and for my thesis, which nurses did right back then, I studied Myra Levine, who had actually used the term holistic nursing in 1969 and again in 1971. She analyzed the concept of holism, which identified a unique role for nurses. She wrote, quote, "Nursing intervention traditionally directed by procedures or manifestations of disease symptoms needs new direction if the holistic approach is to be utilized. The individual must be recognized in his wholeness, and the powerful influence of adaptation recognized as a dynamic and ever-present factor in evaluating his care. The individual's integrity, his oneness, his identity as an individual, his wholeness, is his abiding concern, and it is the nurse's responsibility to assist him to defend and to seek its realization." End of quote. Thus, as hospital-based care increasingly objectified patients, nurses were the patient advocates and their holistic caretakers. Medicine's domain was the disease within the biological model, and nursing's was on the patient's responses to disease. The term holism attained a different meaning and now was used to identify the unique role of the nurse. Holistic patient care legitimized nursing's independent identity within the hospital system. The counterculture of the 1960s produced yet another interpretation of holism. The growing holistic health movement increasingly attracted health practitioners who reacted against the objectification of the patient. They also were disappointed in the effects of science and technology. Now, in the 1950s, medicine was in its heyday. Polio had been conquered, and other diseases were conquered. We had antibiotics. But in the early 1970s and into the 1980s, we began to realize the limitations of medicine. It did not cure everything. And now antibiotics had side effects and had some ill effects. The holistic model emphasized nutrition, exercise, stress reduction, and lifestyle changes. Some incorporated Eastern philosophies and began using acupuncture, herbs, massage, and relaxation. In the 1970s, Dolores Krieger, a professor of nursing at New York University, teamed up with Dora Kuntz, a natural healer, and together they developed the concept therapeutic touch. But nursing shortages in hospitals were increasing all over the country, and nurses became dissatisfied because they did not have time to give holistic care. Many began leaving hospitals to work in other areas. In 1981, the American Holistic Nurses Association was formed, and in 1986, the journal Holistic Nursing Practice began publication, and Virginia Henderson and some of these other authors had papers in that publication. Also in the 1970s, the nurse practitioner movement grew, with nurses emphasizing preventive health care as well as advanced education and clinical roles. But here's another area where there was ambivalence among nurses. This advanced education included specialties, psychiatric, adult, child, women's health, and the like, which focused on one part of the body or one patient population. So in some ways, it went against the holistic role of the nurse. Still, nurse practitioners were taught to understand the patient in the context of his or her whole life. It was also in the 1970s and 1980s that nursing theorists came on the scene, and Dr. Erickson did her influential work on holistic nursing. Jean Watson wrote about caring. Martha Rogers wrote about the science of unitary man. And if any of you all can tell me what Martha Rogers was meaning by unitary men, I would love to talk about it later. Martha Rogers was one person I never could quite interpret. I do have colleagues from New York University where she taught, and they understand it completely because their whole curriculum was based on that. So it's very good. But each of these women expanded our thinking about what comprehensive, holistic care meant. Doctoral programs were growing, and it became clear that nursing research without conceptual and theoretical frameworks was isolated and incomplete. And doctoral programs began to emphasize theory development and testing. Dr. Erickson's theory of modeling and role modeling guides nurses to care for each client by respecting his or her own uniqueness, and it involves integrating body, mind, and spirit. It was also at this time that Barbra, Cornelia Kenner, and Kathy Gazzetta, I worked with all these people, they first published their influential book, Critical Care Nursing, Body, Mind, and Spirit. And I used that book when I was working in critical care, and it's had several reprints since 1981. I also still have that book. In 1987, Jean Sarkis and Martha Schoner did a literature search on the concept of holism and found that it had various meanings in nursing. Was it care of the whole person? Was it a biopsychosocial model? Was it alternative care? Some Christian nurses objected to the emphasis on Eastern religions and advised Christian nurses to avoid holistic healing practices. And these tensions validate my original argument in this talk, that throughout the history of nursing, nurses have used holistic notions to conceptualize their roles and their specific identities in different ways depending on time and context. So let me summarize. History allows us to identify patterns and continuities across time and broad societal forces that shape people and events. Nursing in the 19th century involved care for the whole person at home. Person-based care and care of the dying was practiced by Civil War nurses at a time when dying was far too common an occurrence. Community health programs developed within the progressive era, which provided a rationale for nursing leaders to claim more advanced and efficient nursing education, became much more popular. Public health nursing grew that focused on preventive care rather than care of the sick, but nurses disagreed as to what was most important. In the 1930s and 1940s, as hospital nursing grew, nurses began a greater emphasis on tasks and routines in order to get all of their work done. Yet academic leaders were envisioning other holistic roles that would give nurses professional autonomy. In the 1950s and 1960s, patient-centered care evolved within an increasingly technical environment of hospital nursing. The holistic health movement of the 1960s was part of a counter-movement against these negative effects of biomedicine, and it focused on individual responsibility, self-help, and self-healing. And by the 1970s and 1980s, nurse theorists were turning toward more holistic notions of patient-centered care to establish nursing's distinct identity. When Dr. Erickson developed her model in the 1980s, nurse practitioners were growing, as were critical care units, and nurses were becoming more and more specialized and interested in technology. I was a critical care nurse then. I can identify with that. So her writings were very, very important for people like me. Some nurses were less involved with seeing the whole person in that bed or in that clinic. And it was far too easy to call the chaplain to minister to the spiritual needs or to call the mental health specialist to minister to mental health needs. So in closing, our histories explain our strategic choices, our successes, and our failures. In defining what it is nurses do, the term holistic nursing has served various purposes. In this presentation, I've tried to give an historical perspective that places nurses at the center of long-standing debates about health service delivery, nursing practice, and nursing education. Today, nurses and nurse practitioners still emphasize care of the individual in his or her specific context, and we assert that holistic care is one of the areas that separates nurses from medicine. So, I want to close by saying that we stand on the backs of giants, and many of you are still in this room, and I think that's wonderful. Virginia Henderson is right here. This is Ida Orlando. Myra Levine, our own Dr. Steifbergen, Dr. Brown, Kathy Dracup. She, I believe, was a consultant here, Dean at University of California, San Francisco. The former Dean here, Dr. Dolores Sands. And in the center, I've placed Dr. Erickson. I especially want to acknowledge her and her leadership in all of these areas and helping us to get where we are today by reminding us that a reductionistic model is not what nursing is all about. Thank you.
I believe we have time for questions and comments and conversations. Does anyone like to?
Well, I'm interested in your vision of the future for holism, some projections about this, because I see technology and all these things happening, and healthcare is becoming more and more complex, and practitioners are required to practice in less and less time. And so, any advice or vision for the future?
You know, it is difficult. And I teach students this now, you know, and I've been a critical care nurse, and I know how difficult that is. And I know for the nurse practitioners in the room, you have 15 minutes to see a patient. We can still maintain eye contact. You know, we can still speak in a soft voice. Therapeutic touch, judicious touch, some we have to be very sensitive with culture about that. Not hurried. You know, the things that Dr. Erickson has mentioned earlier, we can still do that in the time frame that we have with people. And I do think in terms of, with all these new healthcare reforms coming, we're going to be seeing nurse practitioners and all nurses take on much greater roles. And this is the time for us to do this. And it's the time for us to show where nursing is different, and to show that and this is where patients get so frustrated too, is that they still feel like they're objectified. And nurses are the best ones not to do that. And I will say that I have heard Arthur Kleinman talk. He's an anthropologist and a physician at Harvard. He does a lot of work on cultural care, but he also does a lot of work on narratives of illness. And he speaks from experience. His own wife, he cared for his own wife with Alzheimer's. He says nurses do this type of care better than anyone else. And I was delighted. He was speaking to a bunch of medical students. I just happened to go hear his talk. And I was delighted to hear that. So I do think it's a challenge for us, but I do think we can do that. And we just have to be cognizant of what it is that we're doing.
I would say one more thing. My husband was very, very ill for many years and saw a lot of doctors. And before he started being nurse practitioners, the doctors were hiring nurse practitioners and they would be in the office. And he came to prefer care from nurse practitioners. When I asked him why, he said because they listen to him.
Yes, exactly. And that doesn't take time.
No.
It doesn't take time.
Well, a little bit of time.
It does, but yeah. But that's true, and I do think that is one of the things that separates us from medicine. And that's not to say that some doctors don't practice in a holistic way too. By all means, some do. But I think by far nurses are the ones to do that, and we have our papers, our marching papers, to go forward with this now. There's so many opportunities for nursing coming up with this new health reform, and I also will tell my students that. People are much less likely to sue when they feel like they have been heard and listened to. And I think nurses, we need to be aware of that also.
I just have to thank you as a doctoral student for putting such a wonderful perspective on what I've been doing for the last 37 years. You really have framed what we're doing so well. So thank you.
Oh, well, you're so welcome. And if you'll notice, a lot of what we're doing is not new. And a lot of what we are doing is new, and that's great. We certainly move forward and adapt. But we can learn from history, too. So it's great. Other comments? That's right.
She's a physician. She writes about the history of the Little Hospital Hospital in San Francisco. And she talks about the care that was given there, how holistic it was, and in particular, how wonderful the nurses were. And she refers to notes on nursing. And this is a doctor that's doing this. It's a wonderful book. I think that anyone would enjoy, many nurses would enjoy reading, as well as anyone who's from San Francisco and this area.
Thank you. And I know that San Francisco, and I'm sure there are other hospitals too, but in San Francisco there is a hospital there that has a whole unit on caring for AIDS patients. And the nurses there are skilled in all of these areas. Holistic nursing is so important in the care of AIDS patients when there's not a lot we can do to heal physically. So that, and they're very good at that too. Other comments? Well, it's great to be back home. Thank you very much.
Thank you.